Hello and welcome. Today we're going to be talking a little bit about data collection. Now, when you do research, you have a lot of different types of things that you need to do set up in terms of thinking about what are my questions, how am I going to design my study, who is the sample going to be for this study. But ultimately, when we're thinking about research as a process of going out into the world and gathering information, it's going to come down to the fact that you need to actually collect data, to actually test your ideas, or to actually gain new information about the world. So this lecture is giving essentially an overview of the different types of health data that we do collect and the approaches that we use for doing that. All right, so first off, I'd just like to say that when we think about data collection, it's really important that one have integrity when we go forward with this process. It's very easy to bias a study by altering your data collection methods to preference one type of response or another. So if we're thinking about research as a process of going out to the world to get information that's good information about what's going on out there, we really have to think carefully about how we can ensure that we're not biasing the information that we're getting from the world that we will then analyze to get answers, right? So this requires some reflection on the part of any researcher to think about how do I prevent my internal biases or preferences or perspectives from influencing the data that I'm getting. So that requires some introspection and careful attention to your processes for collecting data. Now, when you're thinking about what approach to use for collecting data, you have to think about the question that you're asking to begin with, how you've set up the study in terms of its design, what your sampling is, how much money you have to spend on this approach, and of course, different approaches for collecting data have different types of time restrictions. Some can take years, for example. So that's a process where you have to think about all these different considerations to pick out your distinct strategy for doing this, and each have their benefits and challenges. Now, you can sometimes use multiple methods for collecting data. So, for example, you could get biological data and survey data, or do interviews and do observation, for example, at the same time. So you can combine those different methods, but the more methods you use, the more resources are required in the study. So sometimes using multiple methods can give you multiple perspectives, but there's drawbacks to that as well. So you also want to think about these different methods in terms of their various strengths and limitations. And I'll talk to you about that shortly, but that's going to be a major consideration in terms of what direction you ultimately decide to choose. Now, when you're thinking about this in terms of evidence-based practice, pursuing the best strategy or best clinical practice or best public health practice, remember that the quality of the process that researchers use to collect information can be just as important as the tool itself. So you can have a very well-validated tool, right? But if you implement it in a way that introduces biases into that process, it can mess that up, right? Or if you bias your sample that you're asking to respond to this information, that's also important. So there's a lot of different considerations for data collection in addition to just the specific mechanism of how you're collecting. Also, how the process by which you do that is also really crucial. So, for example, if you're doing interviews, having interviewers who are highly skilled and have been well trained is crucial. If you're collecting surveys, making sure that they go to the right people and that you collect them properly, and that there isn't bias in who you collect them from and who you don't collect them from is really important. So there's a lot of considerations to think about there. Now, when you're thinking about this, when you're analyzing papers or thinking about the different data collection procedures that were used, you want to look and see the extent to which you think that the choices that they made are based upon reasonable judgments, and that they have provided some rationale for why they decided to use the approach that they did. Sometimes I'll provide that rationale, and sometimes I won't, unfortunately. And sometimes they'll give you information that you can assess the quality of their data collection procedures, and sometimes they won't. But these are things that you consider in terms of assessing a paper and determining the extent to which you believe the results that they have provided to you. All right, so what are some different types of data collection approaches that one might think about? So I'll talk a little bit about existing versus second or novel data, primary data versus secondary data. I'll talk about interviews, focus groups, another strategy that's used a lot, observations, biophysiological data, very useful, then questionnaires, tests or validated surveys, tools, and then this sort of general category of other, which has many different other strategies for doing this. All right, so let's talk a little bit about primary/novel data and think about that with respect as comparison to secondary data. So primary or novel data is really referring to data that was collected specifically for the study that you're reading, okay? So in order to do that, a researcher needs to think carefully about what information they need to get, and they make those choices and they collect that data. And this approach for collecting your own data is time consuming and it costs money, but it's nice because you get to pick exactly what you want to collect and you'll get it, and you have a lot of control over what information you get and the quality of that data collection. There's also secondary data, and that are also called accessible data. So that could be existing data from medical records, reports. You could analyze other people's reports. And this is very helpful because you can actually collect this data pretty fast often because other people have done that work for you. Now, there's always concerns because you haven't done the data collection yourself. There might be biases for people who collect the data that you don't know about in terms of how they did it. You have less control as a researcher over the quality of that data collection. So, for example, if you're looking at medical records, it's been shown that very often when people fill out people's the race, they instead of asking for self-identified race, they'll just make assumptions about what people's race is without actually talking to them about that. Of course, there's concerns about those categories to begin with, but point being that you don't always know how well different types of information was collected. You have less flexibility because you don't get to choose what information you're collecting. You're using the information that other people have already produced. Now, it has advantages in terms of being quick and cheaper, generally speaking, but there's sort of the trade-offs that you think about that with that as well. And then this is very often foundational for evidence-based practice. Things like reviews and meta-analyses are often considered to be secondary data analysis. Now, there's some discussion around that. So reviews, systematic reviews or meta-analyses or meta-syntheses, some people view their information that they're using as being the papers that they've identified as being the sample itself. And in that context, think of it as primary, but I think it's more common for it to be seen as secondary data. So just to help clarify those types of studies and what they're doing. All right. So a common approach used is interviews. So interviews can be used in both quantitative and qualitative research. For example, you could ask someone, what is your height and weight? And they could tell you numbers, and that would be quantitative data, for example. Or you could ask them could you tell me a little bit about what your experience with depression has been? Interviews are really handy for a number of reasons. One is that very often people really appreciate that personal connection that you get from talking to someone directly. And through that personal connection, sometimes you can get better data for a range of different reasons. One, if you're interviewing someone, you can sometimes ask follow-up questions, for example, if you're doing qualitative research. Or sometimes you can explain what you meant by a question to ensure that their responses make sense in that context. So there's real advantages there. There are some disadvantages too. One is that the presence of an interviewer can sometimes actually bias people. So if an interviewer, for example, conveys their own biases in their expressions, that can influence what information people give to them. There's also some cases where certain types of sensitive information, people might feel less comfortable telling somebody in person. STD prevention practices, for example. People might not feel comfortable talking about that to an individual, whereas they might answer on a survey more honestly. This is a very useful, flexible process. There's a lot of different strategies that you can use to elicit information. You have to be very careful about creating an environment that feels welcoming, but also maintaining that sense of not biasing the person that you're talking to. All right. So focus groups are another strategy that are sometimes used. They're really handy for getting information about certain types of experiences that are shared within certain groups. So focus groups are typically made up of around 6 to 12 people, roughly, somewhere in that range. If you get much lower than that, you don't have enough richness and it's hard to keep conversations flowing. Research suggests that if you get above that, you don't have enough interaction and certain people dominate the conversation. So you gather a set of people together. Typically, those folks are homogenous in the sense that you want a group of people who have a shared experience and have a connection, a pre-existing connection in some way, in the sense that they're not so diverse that they're not going to have a shared perspective or experience. This actually has been shown to produce better data because people feel more comfortable talking about things with other people who have a similar perspective. So you bring those folks together and you usually have one, sometimes two interviewers who will then guide that conversation. And there's different strategies for helping to keep that conversation flowing, asking questions, making sure that one person isn't dominating that conversation. So this is pretty helpful for getting information that certain sets of people might be able to provide about certain experience. Say patients who've had certain types of conditions, or clinicians who've had certain types of challenges in their work, or people who've gone through certain experiences with natural disasters. So it could be people who have different types of experience that they can illuminate. And that experience of talking about it in a group sometimes can provide richer data because people learn from one another, and they actually the experience of having that conversation actually prompts new interesting ideas to come out in these conversations. This is typically done in qualitative research. Sometimes you'll see people do quick surveys in those focus groups, but typically it's a qualitative approach. Another strategy that's sometimes used is observation. So this is where a researcher actually observes something that's going on in a natural environment. So this requires some sort of behavior, behavioral characteristic, something that someone can observe from the outside in order to use this strategy. Now, this approach is sometimes very useful for situations where people may not actually honestly provide information or may not really have the self-perception to be able to accurately answer these questions. So observation, for example, has been shown to be very effective for things like studying hand washing. People, when you ask them what their hand washing behaviors are, consistently say, 95 to or so percent of them will say that they always wash their hands after they use the restroom, for example. But when people actually observe them, those rates tend to be more in the 80%, 70% range. So people's behaviors don't always match up with what they say they are. So observation is really important in those types of situations. Now, you can use this for qualitative or quantitative approaches. So in qualitative research, sometimes you observe people and observe their behaviors, observe how they talk and think about things. And sometimes you even participate in the work, the things that are going on. For example, in ethnographic research, sometimes you'll participate in community activities and see, observe what those communities do. You can also do observation in a quantitative approach. So you can also look, for example, at the hand washing situation. You can check off, yes, someone did this, or no, they didn't. Now, something that's important is having very clear guidelines when you're doing observation about how you're going to interact with people, and preventing one's own biases from influencing those observations, right? Because your interpretation of something will always have some level of being subjective. So if you're observing whether or not someone's getting angry or not, that is something that is kind of hard to do in a consistent way. So you have to have fairly clear expectations or perspectives on that laid out before you do the study, so that people can do this consistently, especially if you have multiple people doing that observation. So there's real challenges there in those types of strategies. So if you think about it, you think about your biases, you think about making sure you have clear procedures, and given those contexts, this tool can actually be incredibly helpful for getting information about the world. There's also biophysiological methods, and that's where we're using some technology, something to actually measure something that's going on in a health-related respect. So one way to measure stress, for example, might be to see whether or not people report that they're stressed, right? But another way is that you can measure cortisol levels, right? And what we see is that sometimes these biological measures can be seen as being more objective than self-report or observation or interview data, right? So this type of objectivity can be valued in research and can allow you to sometimes detect relationships that you can't with other types of information. So there's two different types of biophysiological data. One is in vivo, and the other is in vitro. So in vivo is collecting data that's in the body, so say your body temperature or heart rate or things like that. In vitro is when you take a sample out of the body, so testing for strep, for example, or looking at blood sugar levels, things like that. So those are things that happen outside of the body. So there's a lot of different strategies here. The success of this sort of varies depending on whether you have access to the instruments, how accurate those instruments are, and the cost of those types of procedures. But it's very often used in experimental studies because it's very helpful for creating that more objective data that you can compare in those contexts. All right. Another strategy that's used is questionnaires. So questionnaires is kind of a broad term which refers to different ways that we use. You can use written tools. You can use online surveys. Sometimes you use questionnaires over the phone, for example, and that's sort of a blend between interview and questionnaire. It would be considered a questionnaire if you're sticking exactly to the wording of the questions when you ask them in the interview. And in questionnaires, we're all familiar with them because we've all filled them out. You're asking a set of questions about different things that are of interest to you as a researcher. Now, questionnaires may sometimes be just single items that ask about different elements of people's experience. And any of us could go out and just write up a questionnaire about things that we're interested in. Now, sometimes this produces a very high quality mode of gathering data if you design these surveys very well, but sometimes they are fairly random and we don't have them very well set up. So if we just make them up off the top of our head, the wording might not be right. There might be issues with the formatting. So quality of these questionnaires will vary. Now, typically what a researcher will do is they'll actually do a pilot study to test it out beforehand to make sure that it's actually working well. And sometimes they'll integrate what we call validated scales, which I'll talk about shortly. Now, there's a few different benefits and drawbacks of questionnaires. One is that they're typically relatively quick. They are cheap to do. And sometimes you can get data that you don't easily get from other sources. So, for example, information about sensitive topics like illegal drug use, for example, substance use. Well, sometimes people respond honestly on surveys where they wouldn't respond in person, for example. So it can be really useful in those types of situations. Some of the drawbacks are that these surveys, sometimes they can be long, so you have to keep them relatively short. They show that if you go over 10 minutes, increasingly people stop responding to them. So you'll have what's called a response rate bias, where people who complete the survey and give it back look different than the people who give up and walk away from those surveys. Making sure that people are engaged and stay engaged in these surveys is a real challenge as well. Overall, a useful strategy, but will work better in different types of situations. Now, there's also a subset of survey approaches, which are called validated scales or testing instruments, which are sets of questions that have been put together that have been tested very carefully in the public or in a target population. And these surveys, like the HCAHPS survey, have been very well designed to try and assess different elements that can collect fairly complex information about topics like intelligence, topics that are fairly hard to operationalize. And by measuring them using multiple different dynamics of those complex ideas, you can, having this set of questions that have been tested in a lot of people, having it be validated, can actually give us really strong data about a certain type of experience. They have disadvantages. One is that they tend to be pretty long, so that leads to fatigue for respondents. Another challenge is that if people don't respond to some components that scale, sometimes you can't use any of the data. So there's challenges there. And the other thing is that as a researcher, you don't have a lot of control over these scales. You typically use one that's been used by other researchers, and you can't design it for your own particular purposes sometimes. So there's some challenges in terms of flexibility. So then there's a category of information that we collect, which I describe as other. And the point here is that when we're thinking about research as being an opportunity to gather information from the world, there's so much different types of information that one could use to try and answer questions. So you could imagine collecting and asking people to fill out diaries and collecting narratives of their own experiences. So looking at stories, for example. You could think about your samples looking at news articles, for example. Or maybe you want to look at blog posts or discussion posts from specific groups. I have a friend who did a study looking at discussion boards for people who are going through the experience of trying to lose weight. And by doing a random sample of people's discussion posts, she's able to get some interesting information about how people are thinking about that, perhaps differently than one would get from a survey, for example. So you can even think about asking people to go take out photographs of their experience. And that's another strategy that's being used by health researchers as well. So going out and taking pictures of their community. So there's a lot of different creative ways that you can go and try and get information to understand what's going on with different health-related issues. So one doesn't have to be restricted to just these strategies, although a lot of the ones I mentioned earlier are some of the more common ones. All right. So those are just a basic overview of a lot of the different types of health information that we collect. Each of them has their advantages and disadvantages. I think that it's kind of interesting to think about them and think carefully about why a researcher chose the approach that they chose. what was the quality of the processes by which they gathered that information, and what is the implications of the strategy that they picked. So thank you very much for listening, and take care.